Hello everyone, my name is Laura Cartwright and I am the RN Quality and Education Coordinator. I will be going through this very brief nursing student orientation. I'd like to first say that we're very happy to have you. We love having students in our facilities. We get to show off what long-term care is really like and you get to get a little bit of a glimpse of that. So we are very excited to have you. The first thing I want to talk about is parking. Because parking is limited on our campuses, we reserve our parking lots for our residents and their families, visitors, and staff. And we do ask that nursing students use the overflow parking during their clinical rotations. Your cooperation helps us ensure that families can easily visit their loved ones, and we sincerely appreciate your understanding of that. So on the Highlands campus, that's the one on Newburgh Road across from Bellarmine, we ask that you please park in the Passionist lot, which is located next door to the facility. And there is a sidewalk that runs from that lot to the main entrance of the building. If you are using GPS, you can put in 1924 Newburgh Road, and that'll put you right at the Earth and Spirit Passionist lot. Please do not park in the spots labeled SCN. SCN are the Sisters of Charity of Nazareth. They are the sisters who live in the apartments directly in front of us. So that is their home, and that is their designated parking spot. There are also spots labeled visitor, priest, and physician. Please do not park in those. If you are going to be doing your clinicals at the Clifton campus, that is 2120 Payne Street, we ask that you do street parking all along Payne Street. So you can see here, the facility is located here. Again, there are apartments located in the front, as well as independent living, all included in this building structure. So there are a lot of people needing to park, so that we ask that you please use the designated parking spots along Payne Street. Nazareth Home campuses are smoke-free campuses, so smoking and vaping are not allowed on the grounds of the facility. If you smoke or vape, you have to go off property to do so, and we ask that you kindly dispose of cigarette butts safely and in appropriate receptacles. So Nazareth Home's values, we value our residents' rights. We treat each resident with respect and dignity and care for each resident in a manner and an environment that promotes maintenance or enhancement of their quality of life, recognizing each resident's individuality. Our facility will protect and promote the rights of residents and provide equal access regardless of diagnosis, severity of condition, or payment source. And then we will go in depth on resident rights and resident abuse in just a second, but Nazareth Home is a value-based organization, meaning all actions and decisions need to be grounded in the values of quality, compassion, justice, collaboration, and stewardship. In addition, we will not knowingly or willingly compromise the health, safety, or welfare of residents for anyone or anything. So resident rights. The most important thing to remember is just because somebody lives in a long-term care facility or nursing home doesn't mean that they lose their rights. They have all the same rights that they had prior to coming to us. They have the right to exercise their rights as a citizen. They have the right to be treated with respect and dignity. So what that looks like is making sure that when we go into a resident's room, we knock and introduce ourselves. We state why we're there. Those sort of things, just like you would want if somebody came to your house. They have the right to participate in activities. They have the right to be free from discrimination, free from abuse and neglect, which we'll talk about a little bit more in depth on the next slide. They do have the right to be free from restraints. They have the right to make complaints, get proper medical care. They have the right to have their representative notified. So if they get a new medication or something happens, they get a skin tear or something like that, we do have to let whoever they've deemed as their representative know what's going on. They do have the right to get information on services and fees. So their room and board here, their meals, all of that is covered, but there are some things that are not covered. For example, the beauty shop. We have beauty shops on both campuses. That is an additional charge, so we have to let them know what those fees are. They have to be consistent with what is in the community too. We can't price gouge due to this being their only opportunity to get the beauty shop. They do have the right to manage their money. They have the right to get proper privacy. They do have the right to spend time with visitors, receive social services. They have the right to leave the nursing home as long as it's safe for them to do so. We do have residents who go out of the facility to appointments or out to wherever they want to go as long as it's safe for them to do so. They do have the right to participate in their care plan. They have the right to refuse treatment. It is our job to provide education on what could happen if they do not take a medication or get a treatment or whatever that might be. We do have to do education, but it is their right to refuse it, and it's their right to formulate their own advance directives so they can decide if they want to be resuscitated or not. It's not listed on here, but they do have the right to vote, and they do have the right to receive their mail unopened. So we can deliver mail to their room, but we cannot open it for them. So abuse and neglect, we'll go through the different types. Verbal would be cussing, yelling, or intimidating someone. Physical would be hitting, kicking, pinching, biting, anything where you're physically hurting a resident. Sexual would be unwanted sexual physical contact. Mental or emotional would be ridiculing or insulting someone or making them feel guilty. Involuntary seclusion would be confining or isolating someone against their wishes or restricting them. So an example of that might be if I said, if you don't eat dinner, you can't go to bingo, that would be involuntarily secluding that person. There is one caveat to this, and that is people who are on isolation precautions, someone who has something contagious that could spread to others, because it is a communal living situation. The rules of that remain the same, though. We would still go in and provide care. We just have to wear appropriate PPE. They are still permitted to have visitors, and we keep them in for the shortest amount of time possible. So as soon as they are able to come out of isolation, we would take that away and they would be able to come back out of their room. Misappropriation of property is deliberate misplacement, temporary or permanent use of a resident's belongings or money without the resident's consent. And then neglect would be denying care to someone who depends on us for care. So someone who cannot reposition or self-turn if we were not turning them appropriately and it led to skin breakdown. Or if they needed assistance with eating and we weren't providing that and it led to weight loss, those would be signs of neglect. So the most important thing is if you witness abuse or a resident tells you one of these things has happened to them, we ask that you go and immediately tell your instructor, and your instructor immediately come and tell one of our members of management. As soon as we know about it, the perpetrator, the person who, the alleged perpetrator, has to leave the building. They are not allowed to be anywhere where residents are while we do an investigation. So as soon as you see something, please say something. We have to protect the resident. We only have 2 hours to report all of this. We have to report it to several different agencies and do our initial investigation. So we have to start looking into what happened and interviewing people. So as soon as you see something or hear something from a resident, and err on the side of caution. So if you're not quite sure, go ahead and report it, because we would rather know and it be nothing than run the risk of letting abuse happen under our noses. So all nursing students are obligated to report a suspicion of a crime, so notify your instructor, who will then notify the administrator, director of nursing, administrator on call, or a designee. Nazareth Home Administration needs to be notified immediately of all alleged violations involving abuse, neglect, exploitation, or mistreatment, including injuries of unknown source and misappropriation of property. They are responsible to report to outside agencies such as law enforcement and state survey agency. Just culture. Residents, families, visitors, and staff are encouraged to report concerns, incidents, and grievances without the fear of retribution. Individuals who report an event will not be retaliated against by the organization. An individual who retaliates against someone for reporting a crime will be subject to disciplinary action. We have signs posted near the time clock to promote communication to individuals regarding reporting requirements under the Elder Justice Act, and other key aspects of the act are located there as well. So infection control and hand hygiene. On the left here, you see a picture. This is the most missed areas when people are washing their hands are in red. What's often missed, and then what's usually cleaned the most. So you can kind of see a breakdown there. It's just a reminder to do really thorough hand hygiene. And then the 5 moments of hand hygiene. So before we come into contact with any kind of patient, we need to make sure we have clean hands. So you want to hit the hand sanitizer before you go in. Before we do any kind of aseptic task. If we have body fluid exposure, we need to do hand hygiene, and then after patient contact. So, and after contact with the patient's surroundings. So before we go into the room and after we go into the room are the bare minimum requirements for hand hygiene. And then anytime they get soiled or you had an exposure to them getting soiled or you touched anything with your hands. Also, whenever you remove gloves. So if you had gloves on, you take them off. Really good to go ahead and just do hand hygiene. Long-term care facilities are required to implement enhanced barrier precautions. This is sort of new to all of us. It's only been around for a couple of years, but enhanced barrier precautions are required for the following resident activities, and you can see those listed over there. So anything really where you're coming into contact with a resident, like skin to skin, where I would be touching them. So dressing, bathing, showering, transferring, changing the linen, providing hand hygiene, changing a brief, assisting with toileting, any care to their devices like a catheter or feeding tube, and then any wound care. So what enhanced barrier precautions is, it is not isolation precautions. This person does not have anything that is a potential thing they could spread to someone else. The risk is us bringing something to them. So we run the risk of spreading multi-drug resistant organisms to the resident. So for that reason, when we go into the room, someone who's on enhanced barrier precautions, and they'll have this little logo on the outside of their room so that you know that. We need to be wearing gloves, which we should be doing anyway for any of these activities, but we also need to be wearing a gown. So you would come in, you would do your hand hygiene, put on your gloves and your gown, and then you would take those off when you leave. But again, it is not isolation. This person has nothing. Enhanced barrier precautions are for people who have something that it puts them at a higher risk for getting an MDRO. So it's going to be people who have anything that goes into like a major organ, so like a PICC line, G-tube, catheter, things like that. Anyone with a device going into their body, or if they have a wound that requires a dressing change, that would require them to be on enhanced barrier precautions as well. HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. All Americans have the right to have their information kept confidential and secure. Down at the bottom is when we can share private health information according to HIPAA. So if it relates to healthcare operations, if you're reporting abuse, audits, law enforcement, legal investigations, to avert a serious threat to health or safety of someone else, or the coroner or medical examiner can make that request. That is when we can share private health information. You will have access to our electronic medical record. We just ask that you please sign out of that when you're not using it. Don't go into records of people that you aren't actually looking into. We also have things on paper, so CNA care plans, care cards, nurse report sheets, things like that or care plans you may want to be looking at. Just make sure that when you are done with those, make sure that those end up in our shredder boxes so that they don't end up in the regular trash, and that we don't leave them laying around because they do have private health information on them. Knowing your different codes. So we have different codes that we can page overhead. We ask that you follow whatever your instructor tells you to do, but we do want you to know what they mean. So code red would be going off. We would announce that during fire or a fire drill. So you'll hear the fire alarm go off, and then they would page code red. So that is a fire. Code blue is a full code person who is a full code who is not breathing and has no pulse, someone who requires CPR. Golden alert is a missing resident. That is an elopement. So we have someone missing and we have to stop everything that we're doing and search for that person. We also page nurse stat overhead. So that would be a non-life-threatening care need. So not CPR, but we need a nurse to come. So like if a resident was in a activity area or in the chapel or somewhere outside of their normal unit and they fell, obviously a nurse has to go and assess them and make sure that there's no injury or anything like that. We would page nurse stat for that. And then if there is a tornado, we do have weather radios at all of our nurses stations and the reception desk. They would page overhead if we had a tornado watch or warning. And again, we just ask that you follow whatever your instructor asks you to do, which would typically be just to shelter. All right, well, thank you. Welcome to Nazareth Home. We're very excited to have you. If you have any questions, you can reach out to me. Your instructor will have a contact person, and we would be happy to answer any questions that you have. But welcome, and we'll see you soon.